Hello, everyone. I'm going to take you on a little running stop tour of what we've been doing at Unicef UK Baby Friendly Initiative in response to the COVID outbreak. First of all, though, I just thought we should reflect on why Baby Friendly exists and what we're doing and what we've been doing actually for a long time now around the world and in UK. Everything we do at Baby Friendly is based on the UN Convention on the Rights of the Child. And this is the world's greatest promise to all children to ensure that their rights are met. And one of those rights is around their nutrition and that they receive breast milk where possible. And this was celebrated with its 30th anniversary last year. So as part of that promise, we're looking at today why breastfeeding matters and why we're Baby Friendly aims to support that through its care and support for health professionals. So fundamentally, we know that breastfeeding and breast milk itself, human milk, reduces the risk of babies developing infections and improves the health and well-being outcomes for babies, their mothers and families in the short and long term. And there's no evidence at this time from any of the research that coronavirus can be passed through breast milk. And indeed, if in donor milk, it would be, if there was any virus there, it would be killed by the pasteurization process. So therefore, as health professionals, as midwives, healthcare assistants, health visitors, we should do all we can to promote, protect and support breastfeeding and the use of human milk for all babies and their mothers at this time, and their families, and indeed that they deserve that best care we can provide for them. So these are some of the things we've been doing. Our aim is very, very much primarily, and you'll hear from Amy more about what the mother support groups are doing, but our aim is to support health professionals to continue to provide the best care related to infant feeding during this time. And you can find all the resources I'm referring to on the website under that link. Just Google Baby Friendly COVID-19. So we've got three statements. The first statement is a general statement about infant feeding. It covers both breastfeeding and formula feeding and gives some background and some key principles of care during the outbreak. The second statement is on care within neonatal units. And really, our three standards in neonatal units are to provide breast milk for babies, but also to support parents to have a close and loving relationship with their baby and support parents as partners in care. And lots of us have heard stories about mothers and babies being separated. We are updating this statement this week because the evidence has moved on, and we really do want mothers and babies, parents, to stay with their babies on the neonatal unit where possible. Our third statement is around all of you who are working hard to implement the baby friendly standards. Obviously that's changed because of the situation, and there's more information on how we can carry those out remotely on some occasions, but what we're planning to do going forward. One of the things that came to light very early on was for those families that were formula feeding, in the initial stages, there was a shortage of formula milk in the shops. However, that has settled down, but there are also more families in crisis at the moment and turning to universal credit, and there may be delays in them being able to afford or access infant formula. And this is a guidance document for local authorities to help ensure that they do that through in light of the International Code of Marketing of Breast Milk Substitutes. And what have we been doing for you as midwives? Well, all of the work that Sue talked about from the Royal College of Obstetricians and Gynecologists and the RCM highlighted how some of the roles of the midwife and who's delivering care has changed. And we know that for some people now delivering that care, it might be a third-year student who's progressing quickly to qualification, or a maternity care assistant, or a midwife returning to practice after many years. And we wanted to look at what would work to support all of you, but those as well, in having that virtual conversation that you may never have done in your career before, so that when you're sat on the phone, you've got a prompt sheet next to you and you can make good and accurate records and make sure that they're completed accurately. So we've got one on the actual conversation, on antenatal infant feeding conversations, postnatal conversations, and then also when a mother and baby are separated because of the coronavirus, maybe the mother has the virus and she has to be separated from her baby in the neonatal unit, how you keep up that close and loving relationship with the mother and baby by maybe doing video contacts, having, you know, things that the mother can wear down her bra that get swapped between the baby and the mother so they have the smell of each other. We've also heard of women who are trying to maximize the amount of breast milk they're giving, or even relactating in this time, knowing that breast milk can help to reduce the risk of respiratory infection. Of course, women will do, when they start to breastfeed, some women come across challenges, and the midwife in her consultation over the phone will also have to have conversations about that. So again, we've done some prompt sheets and guidance sheets on having a conversation with mothers where there's a challenge on various topic areas, and they take you on a step-by-step approach on what would work and what could work and when you need to refer on. Obviously, safety is a key challenge here, and recognising when things aren't right. The midwives known as being a career that and a skill that is both an art and a science. And when you can't feel and touch a baby and see a mother, it can sometimes be difficult to make that assessment. So these guidance sheets are hoping to help you prompt those conversations in that way. And also to support that person who may be devolved to this job, and they may be asked to help the infant feeding lead out, or do an infant feeding lead role because infant feeding consultation because the infant feeding lead may have coronavirus. She may want to refresh herself on her knowledge and skills around infant feeding. So we've done some quick, like one-stop shop, bite-size refresher sheets for those working in infant feeding. And particularly around positioning and attachment, getting breastfeeding off to a good start, hand expressing, all those skills that you would normally maybe do on face-to-face, but you might need to just refresh your own knowledge and skills to give you confidence over the phone. So what other work have we been doing? On the webpage, we've got a series of frequently asked questions where we're updating them on all the time. And trying to answer questions that come up on Facebook, on Twitter, through the media, from individuals from the Infant Feeding Network, so that we remain contemporary and up to date and can help people still provide the best care possible. And then a couple of weeks ago, I mentioned in my opening that we run the National Infant Feeding Network. A couple of weeks ago, we sent out a survey monkey to all the infant feeding leads in the country and had over 225 responses. And the survey was looking at how services have changed since the beginning of the outbreak, and to both the infant feeding leads and to the provision of services for mothers. For example, can they still access an infant feeding specialist? Can they access tongue tie services? Is there still an infant feeding lead in post? And we're just collating those results at the moment, and they'll be out probably next week. So look out for those coming through our websites and through the network. And to conclude, and maybe going back to what Sue was saying about reflecting on those in the service that have been lost to coronavirus. Unicef is there to protect all children, and part of our values and principles are about being honest. We're trying to be honest with the health professionals and with midwives and with women, and say what we can provide and what we can do at the moment. We're trying to be smart by getting things out to you promptly and in a manner that's usable and user friendly. We're trying to be brave by very much in the neonatal care, we're seeing mothers and babies separated, and maybe that's not always the best way forward. And so being brave to say that and looking at ways we can use the knowledge and evidence that we've got to keep mothers and babies together, and fathers, and have them as parents, as partners in care, not visitors in a neonatal unit. And we look to be hopeful. We want to make sure that, again, as we said at the beginning, babies are still being born, mums are still getting pregnant, and we are hopeful for the future that we will use what we're learning now, build on it, and take the best of it into our future practice. And today, Unicef UK Global and Unicef UK, as a bigger organisation, launched a campaign to save the generation COVID. They feel that it's the biggest global crisis since the World War II. And new research shows that 6,000 children a day could die in the next 6 months because of coronavirus, because of weaknesses in the national health systems and disruption to vital services across the world. And they're asking for support from all of us if we're able to give that. So please go to the website and have a look. Okay, I don't know how I'm doing for time, Sue, but that comes to an end.
Okay, that's fantastic, Francesca, and I think that's quite well, it's a sad point to kind of end on, the thought of a generation COVID. It's kind of, because people are talking about, when it's at an end and we go back to normal. Of course, there isn't going to be a normal, and there's going to be a long time with mothers and babies and families who are affected. And I think that's important for us to remember. So thank you for bringing that to the end point, even if it is quite uncomfortable.
It feels like it reflects on what you said, really, about the healthcare workers as well, so that we can do what we can at the moment, but we mustn't forget where the effect this is having
on a wider picture. Yeah, that's great. Thank you very much, Francesca. I know there'll be some questions for you after at the end point.
Thanks for watching this video from the Maternity and Midwifery Forum. For more expert opinion and analysis, hit the button below to subscribe.